Welcome to Myra Doctor. I'm Dr. Pyali. Today I'm going to talk about depression, which is a very familiar topic to all of us. But we should know everything about depression. It looks very simple and easy, but it's not that simple. So depression becomes a very similar and familiar topic like a common cold, viral fever. Many of us are suffering from that. So sometimes feeling sad and unhappiness is fine, but when it started interfering with our daily activities or with our daily needs, everything, so then it become an issue. So today I'm going to talk about the definition of depression, then classification of depression, epidemiology, what are the causes of depression, how you prevent depression, and the management. As I said earlier, the depression is complicated. It is really complicated. I'm going to tell about depression, how to understand the disease and how to overcome the disease. So coming to the definition of WHO, what WHO actually describes of depression. So according to WHO, it is a common mental disorder that presents with a depressed mood, our loss of interest or pleasure, decreased energy, feeling of guilty or low self-worth, disturbed sleep and appetite, and poor concentration. Moreover, depression often comes with the symptoms of anxiety. And when depression turns its course, it leads to suicide, which translates to 3,000 suicide deaths every day. For every person who completes a suicide, 20 or may attempt to end his or her life. So it is one of the leading cause of disability as measured and the fourth leading contributor to the global burden of disease in 2000. So we are coming to the epidemiology of depression. That's the incidence and prevalence. Mood disorders are common. In the most recent survey, major depressive disorder has highest lifetime prevalence, almost 70% of any psychiatric disorder. And the lifetime prevalence rate for major depression is 5 to 17%. And it's according to universal observation, it is more common in women than in men. The reason for the difference are a hypothesis to involve hormonal differences, the effect of our childbirth during psychosocial stress for women and men, other behavioral models of learned helplessness. And it mainly seen within for above 40 years, but 50% of onset nowadays are seen in 20 to 50 years of age. It can also occur in childhood or in old age. And marital status also have an impact on this depression, and there are other socio-economic and cultural factors also. So let us see the cause of depression. The cause first is genetic and hereditary. Numerous family, adoption and twin studies have more prone in causing depression. There are some biological, biochemical and medications which cause depression, like the monoamine neurotransmitter like epinephrine, dopamine, serotonin, which are two neurotransmitters most implicated in the pathology of mood disorder. And some medication like corticosteroids, which are used to cure gout, arthritis, and medicine which is used to treat Parkinson's disease. And there are some H2 blocker, that is called, and proton pump inhibitor, which are used to treat gastroesophageal reflux disease, that also can lead to depression. And there are some lifestyle and environmental factors which plays a major role, like alcohol, abusing drugs and alcohol, overworking, diet is poor, too much of caffeine or sugar, less exercise, poor sleep, as well as less fun and recreational activities. And one of the main important cause of depression is the socio and cultural factors. First is divorce, then the childhood depression, what I am talking about, differences between mother and father in the childhood. When the child is growing, it creates a very big impact on the child, which leads to a depression. And there are factors like child abuse. There are some personality factors like OCD, like obsessive compulsive disorder. Person having OCD are more prone to cause depression. So what is actually depression? Sometimes we feel that there comes a point where you no longer care if there is a light at the end of the tunnel or not. You are just sick of the tunnel and you feel that your world is just inside these four walls. Sometimes you don't even feel of getting up from the bed, not even going outside from your bedroom. So the causes we have discussed. Now we are going to discuss about the types. There are several types of depression. Coming to the major depression, which is called clinical depression or unipolar depression. It involves low mood, loss of interest or any activities. Symptoms of depression interferes with all person's life, including work and their social relationship. There are minor depression like psychotic depression, postpartum depression. Sometimes people with depressive disorder can lose touch with reality and they experience psychosis. This can involve hallucination, that is like seeing or hearing the things that is not there, or delusion, that false belief that you aren't shared by others, such as believing that they are bad or evil, or they are being followed or watched by someone. And what is called postpartum depression. The postpartum depression is seen in women and it's immediately following after birth. This is called baby blue, which most of the women experience, which is a common condition related to hormonal changes, and it almost affects 80% of women. So, and this depression is long lasting and can affect not only the mother, it can affect the child also. So, and the last and the most important type of depression is a bipolar depression. It is one of the important type, and it is known as maniac depression because a person experiences periods of depression and periods of mania with periods of normal mood in between. Symptoms including feeling great, having lot of energy, doing a lot of walks, and sometimes they don't feel like doing anything. They feel frustrated, they feel irritable. Sometimes the person loses touch with reality, like I said in psychotic depression, and they get the episodes of psychosis, like they hear or seeing something which is not real. Now we are talking about the clinical features, signs and symptoms of depression. Symptoms we can see in our daily life, like how the people are facing the symptom, like they feel very sad, they feel very tired, they feel trouble of focusing on concentrating a small work on their regular work which they used to do it before. They are unhappy, they get angry very easily, they are irritable, they frustrate, they don't sleep, sometimes they get insomnia, anxiety, isolation. They just don't want to go for any social gathering, nothing. They want to keep themselves isolated. Suicidal thought or tendencies, drug abuse, alcohol abuse. Suicidal thought is the most important sign in a depression. You know, it's very difficult to tell how the person, we can't even realize how to be just to do their daily stuff like shower, brush their hair or get out from the bed. It's really difficult for them to do all this. They start thinking of committing suicide. They want to just end their life. They talk about how to kill themselves. They just think that they are like not worth living. Their life, they just want to end their life. So this suicide and all this. And there are some drug or alcohol abuse. They think that if they are on drugs, they can live a happy life, or they can live a life, or they started depending on alcohol more than any other things related to depression, like post-traumatic stress disorder, then obsessive compulsive disorder like panic disorder, then generalized anxiety disorder. Some depression may occur with serious medical conditions such as cancer, stroke, heart disease, HIV, diabetes and Parkinson's disease. So this is all about depression. Now we have to come to the diagnosis. So the person who is depressed, we should know the diagnosis. We should stop them from taking the worst step of their life, of ending their life, or getting into drugs or taking alcohol. So we should know, we should see our surroundings, we should see our friends, and we need to find out who is depressed. And so we have to diagnose their condition. First diagnose is the history collection. We have to take the detailed history of the patient. When the patient approaches us, we need to know about their detailed history, like their family history, like what they are undergoing, what they underwent, or everything like that. And we have to know about their mental status examination we have to conduct, like we have to know their appearance, how they appear in front of you, how they talk, how is their mood, how is their behavior. Now one more most important diagnostic criteria is called ICD-10. This is none other than the diagnostic criteria, in which there are some major symptoms and minor symptoms. Major symptoms like depressed mood, loss of interest in pleasurable or enjoyable activities, decreased energy, like they feel easy fatigability and diminished activities. Then minor symptoms like reduced concentration, reduced self-esteem, reduced attention, feel ideas of guilt and worthlessness, they feel of self-harming and suiciding tendency they have, disturbed sleep, diminished appetite. Sometimes they feel like they don't want to eat, sometimes they overeat. So after knowing after we diagnose the patient, we have to see about the management. First, we should give them some antidepressant. Antidepressant, what they work on brain chemicals such as called neurotransmitter, especially on serotonin and non-epinephrine. And some antidepressant work on the neurotransmitter dopamine. There are three types we give: selective serotonin reuptake inhibitor. Then we give fluoxetine, sertraline. We also give tricyclic antidepressant. They are older and powerful, but they are not given nowadays because their side effects are very serious. And one more drug which is used is monoamine oxidase inhibitor. This is the oldest antidepressant drugs, and it is mainly used to treat atypical depression. If these drugs are not working out, we can go for psychotherapy, or we can go psychotherapy parallelly along with antidepressant. Like psychotherapy are cognitive behavioral therapy, interpersonal therapy. Cognitive behavioral therapy helps person with depression restructure negative thought patterns, and interpersonal therapy is which help people understand and walk through troubled relationships that might cause depression. And when nothing is working out, we should go for electroconvulsive therapy. For cases in which medication psychotherapy is not relieving a person's treatment, or the depression is still resistant, then we should go for electroconvulsive therapy. So we should always remember, sadness is always temporary. This too will pass, and we should always come out from depression. Depression is not a long-lasting disease. We have to come out. We have to find we have to find ourselves, how we are, how we were, how happy we used to be, how charming we used to be. We have to find ourselves, and then everything will be fine. And we can come in a normal life and can lead a happy life like every other individual. Thank you so much.